Hey everybody, we're going to get started. Let me put this into slideshow. Okay. We're going to be doing the module on health literacy. I apologize it's a little late this week. I wanted to start out first by thinking about a scenario. Imagine a doctor who's in an office looking at his laptop or her laptop and pulling up some results and saying to the patient, we got the biopsy and it looks like a neuroendocrine cancer. They did the stains and it is pomegranate positive, synaptophysin positive, negative, and they did all the different markers. We need to do gene sequencing and extract some DNA. Imagine Mr. Jones is sitting there, silent. The doctor then says, I looked at your labs. Your white count is on the low side, but your hemoglobin, your platelets are good. Electrolytes and liver function look good. What should we chat about today? Is what you want to do about your treatment. A pause. The doctor then says, Mr. Jones, did you understand any of that? Mr. Jones says, nah. Think about that conversation and all those words that were put forward to that patient. One of them I couldn't even pronounce. So we're going to be talking about health literacy, and that also extends to e-health literacy. Health literacy, as defined by the World Health Organization, is they define health literacy as representing the personal knowledge and competencies that accumulate through daily activities, social interactions, and across generations. Personal knowledge and competencies are mediated by the organizational structures and availability of resources that enable people to access, understand, appraise, and use information and services in ways that promote and maintain good health and well-being for themselves and those around them. The World Health Organization further goes on to say that health literacy means being able to access, understand, appraise, and use information and services in ways that promote and maintain good health and well-being. Think about that for a second. Means being able to access, understand, appraise, and use information and services in ways that promote and maintain good health and well-being. It's more than just being able to access websites, read pamphlets, and follow prescribed health-seeking behaviors. It includes the ability to think critically about, as well as the ability to interact and express personal and societal needs for promoting health. That's a lot to chew on. And I think your two modules that you're assigned for the two self-learning modules that you've been assigned for this module itself do a really good job of talking about health literacy and about one way to be able to address health literacy and to promote health literacy. There are so many ways now to get health information, and not all of it is good information. Here they say accessing websites and reading pamphlets and following prescribed health-seeking behaviors. And that's a lot to digest as well. Think about it in your daily activities of daily living. So health literacy, as defined by Parker and Ratson and Parker, say the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Health literacy is the ability of an individual to attain and translate knowledge and information in order to maintain and improve health in a way that is appropriate to the individual and system context. You can see a lot of these definitions really emphasize the ability to be able to take the information that's given and to be able to process it and to be able to utilize that in an effective manner. And they need to be able to understand that information. It needs to come in a way that people can synthesize it and then make decisions based on that information. E-health literacy, this has gotten a lot of attention in the last 10, 15 years. It's the ability to appraise health information from electronic sources and apply the knowledge gains to addressing or solving a health problem. It encompasses the skills and abilities needed to access, understand, validate, evaluate, interpret, and apply online health-related information. Not all information is good information. People joke around a lot about where did you get that information from, Dr. Google. It's one of those funny, not funny. Not all the information that you find on the internet is good information, and there are sometimes nuances to the information that's out there for people to make specific health decisions. They shouldn't go just by what they see. On the internet. I'm going to use the example of going in to have a repair, maybe of a fracture, and what might be involved with the care afterwards of that. It may not talk about, it may not give people the right information. It may be they may be making decisions based off the information they get. It may not talk about driving restrictions. May not talk about bathing restrictions. It may not talk about the aftercare. Say somebody who had pins put in, maybe about getting those pins removed. Different things like that, and what might be what a patient could reasonably foresee as being. What kind of pain they might have after a procedure like that. Some of the statistics. The National Assessment of Adult Literacy Survey found that 36% of adults had basic or below basic health literacy. And understand, please, that it doesn't necessarily mean that you have to be poor or have, a high school diploma. These are people who can be highly educated, may not have the basic skills in order to make sound healthcare decisions. The Milken Institute said that found that 88% of adults living in the U.S. have health literacy inadequate to navigate the healthcare system and promote their well-being. 55% are at the intermediate proficiency, 22% at basic, and 14% below proficient, and 12% are proficiently health literate. Now, those statistics are pretty staggering, especially when you consider how challenging the healthcare system can be with different healthcare plans, with different payer systems, whether or not you may need a referral, what your annual cap may be, your out-of-pocket expenses, and those are just some of the financial aspects of it. Never mind some of the the other parts of healthcare, such as health promotion, or when you enter an acute or chronic illness phase, some of the decisions and information that you need in order to make effective decisions. Low health literacy is associated with more hospitalizations, greater use of emergency care, decreased use of preventative services, poor ability to interpret labels and health messages, poorer health status, higher mortality, and higher health care costs. Now think about, I'm going to go to the interpret labels. Take something as simple as a probiotic. When you see how many million units of the level of, God, I'm blanking on the word, but, how do you make a decision about how many million units you need, and for what use do you use those probiotics for? Higher mortality, higher healthcare costs. This bullet in and of itself really speaks towards the quadruple aim, and those factors that health literacy has a profound impact on, access to care, as well as the cost of care. The impact to the U.S. economy for low health literacy is upwards of $238 billion every year, and that's a very recent statistic. Risks to low health literacy include people in a lower socioeconomic status or less educated, the elderly, low English proficiency, or those who might not be native speakers of English, and those receiving publicly financed health coverage or other socioeconomic assistance. Those are some of the risks. But as I said, it can also include low health literacy can include people who can be considered well educated or affluent. The U.S. Office of Disease Prevention and Health Promotion actually has a health literacy guide, and it's a guide for simplifying the user experience. It's a research guide that will help organizations to develop intuitive health websites and digital tools that can be easily accessed and understood by all. The U.S. government has taken a serious approach to looking to ways to increase access for people and as well as to reduce costs. They're also looking to reduce burnout of providers, and when you have people who are not utilizing the healthcare system in an efficient way, you obviously you impact your providers as well. Healthy People 2030 said that personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Organizational, that Healthy People define health literacy into two categories: the personal health literacy and then the organizational health literacy. Organizational health literacy is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So not only is there a personal responsibility, but organizations have a responsibility as well to facilitate health literacy for all people that they care for. Inadequate health literacy is often associated with difficulties in comprehending health information, limited knowledge of disease states, and that disease states include ways to manage the disease, looking out for complications. There's less compliance with treatment plans, lower medication adherence, and poor utilization of healthcare service. These can lead to poor health, higher risk for mortality, widening of health disparities, higher costs, higher hospitalizations and readmission rates, and poorer quality of life. People with low health literacy are more likely to adopt an unhealthy lifestyle, such as smoking, poor nutrition, lack of exercise, and they're less likely to seek out preventative services. They can be more of the foxhole type of health care. They seek care when they're sick rather than when they're well, so that they can continue their continuum of health and wellness rather than being in a sick state. So why is it important? I think you probably can figure this out. It's to improve the health outcomes. It empowers patients and caregivers. It improves decision-making, lowers costs, higher patient satisfaction, and reduces the burden on the healthcare system, such as acute care stays, ED visits, multi-pharmaceutical regimes that patients need in order to manage their disease, which is, much higher costs. And I really like the second bullet where it said it empowers patients and caregivers, especially the patient part. I think all patients want to feel that they are making the best decision that they can for their long-term survival and health. Health literacy really speaks to these four quadrants of the quadruple aim. lowering the cost of care, reducing the burden of people and the incidence of chronic illnesses, reducing the cost of care, better utilization of resources and services, reducing readmissions, lowering mortality and morbidity, enhancing the patient experience. Again, this goes to making patients feel like they're an active member in their care. They're more engaged. They're more committed to their health and a more positive outcome. Again, that's that empowerment. And then improving provider satisfaction. And what this means when it says provider is really any type of licensed or unlicensed clinician in the healthcare area that is interacting with patients and caregivers. We really want to reduce the burden, that cognitive burden and the physical burden to reduce overall burnout. Health literacy, again, this is just kind of, again, going over is the ability to process, understand, and use health information to stay healthy, right? We don't want to use it. I mean, ultimately, the goal is to use it to stay healthy, but it's also to make good decisions if your health is negatively impacted. The degree to which individuals have the ability to find, understand, and use information and services to inform their decisions and their action for themselves and others. Health literacy has been defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. So you'll see that that definition has you'll find that definition in a lot of the literature that you read on health literacy or digital literacy, which is the ability of individuals to access, comprehend, and use health information digitally. This is gaining prominence. It's actually morphing into more of an e-health literacy. The term has changed a little bit, and they're also looking at the ability to empower versus overpower individuals, which when they mean overpower, they mean to overwhelm them with too much information. Health literacy really is nested within the social determinants of health, and these social determinants of health, as we know, are associated with a broad range of short-term and long-term health outcomes. So you can take a look at this. Really, that health literacy is the cornerstone of good health, and feeling empowered and being able to make decisions to better your health and wellness. The WHO and HHS recognize health literacy as essential for achieving health goals and reducing disparities. It's also vital for improving health outcomes and reducing costs. Proficiency in health literacy and improves health status, reduces health service use and costs, and extends life. It's really associated with better adherence to medical recommendations, and that includes, ways to eat, not smoking, exercise, taking your medications, getting the necessary preventative health services and screenings. Patients with low health literacy, this is taken from the cdc.gov, are more likely to visit the emergency room, have more hospital stays, are less likely to follow treatment plans, and have much higher mortality rates. So again, some of this is just rehashing what we've already talked about. We want to empower individuals and families, and call them health units, and that can be patient and caregiver or family member and caregiver. Increase awareness of health and what people can do to gain better control over not only their health decisions but their overall health. We want to emphasize people's ability to use health information rather than just understand it. Focus on the ability to make well-informed decisions rather than appropriate ones or just-in-time kind of decisions. Impact at the community and the individual level, and being able to help our customers, our clients, our patients to be able to use some of these tools that are out there, especially a lot of the digital tools that are coming up, and being able to use them to positively impact their health literacy. And some of these things can be AI tools, chatbots. It may be some apps to help them follow their health. I think some of the first ones were, allowing, not allowing, but being able to track your steps, right? Your exercise. Could be taking time out for just a quick bio break during your day. It could be just getting up and doing a stretch, maybe some meditation. There are different kinds of tools out there, not just those that might provide information to help make decisions. Plain language. So this is really an important one. The Plain Writing Act of 2010 requires federal agencies to use plain language in their communication with the public. And this includes their any kind of health information that goes out. It has to be clear and able to be understood and used. And this also applies to any hospital that accepts federal funds, such as Medicare and Medicaid. So plain language is about readability. Now this looks like something I'd read, right? Being able to put it into terms that people can understand. Going back, remember to that conversation, that mock conversation that I provided at the beginning of the video, with some of the words, one of them that I couldn't even pronounce, using common phrases, this plain language that allows patients to better understand. If it gets too technical, a lot of times people will just phase out, and again, impacting their ability to make informed decisions. So some resources that are out there are the AHRQ. On health literacy. They also have a lot on there on plain language. You'll be doing some videos, looking at some videos about the teach back method. We use this a lot where one of the facilities that I worked at, we had defined tools, standardized tools to help nurses as they were educating specific patient populations. We rolled it out with a few high-risk populations. The first one was the patients with congestive heart failure, because they are frequently readmitted back, frequently have high readmission rates. And we also used it for patients who were newly diagnosed at diabetics. The CDC as well has a lot of information on plain language. There are also some other health literacy and teach back resources. And there are some assessment tools that are out there available for health literacy. And I will provide this slide so that you will have it to use, so that you can access some of these resources as well. Some of the models used to address health literacy by the Institute of Medicine, the knowledge of healthcare and health systems, processing and using information in various formats in relation to health and healthcare, ability to maintain health through self-management and working partnerships. And I lost my notes on this one, so I apologize. The IOM also has a model of health literacy that has four constructs: cultural and conceptual knowledge, printed health literacy, which really goes to that plain language, making sure that the written language is easy to understand, and that it's done at a reading level. I believe it is a sixth grade reading level. And then oral health literacy, which is the ability to listen and speak appropriately to patients, again, to use that plain language, and numeracy. A little bit about teach back. So the teach back, you have an article that is posted in Brightspace, and it talks about the 5 T's for teach back, right? There's delivery and reception, triage tools, take responsibility, tell me, and try again. The article does a much better job than I would on this. But again, if you are teaching, you try to focus on just one topic at a time. Use a written tool to help, and that providing graphics can really, a picture can really enhance a person's learning. And take again, I like this one, take responsibility. I want to make sure I did a good job explaining. Sometimes I know I have a habit of going off sometimes, and I tend to lose focus sometimes when I was teaching patients. Tell me, ask the patient to tell you in their own words what they will do and what they understand. Be explicit about what you want the patient to say back. Again, I'll use the example of a newly diagnosed diabetic patient, right? We want them to be able to know about, for example, you want them to be able to talk about what their blood sugar level should be maintained, what foods they should be eating, how to manage high or low, what signs and symptoms to look out for, what type of scenarios might put them so that their blood sugar might run too high or too low. And then repetition. Recommended other recommendations to address health literacy. It's the 6th grade reading level, should apply to overall content to improve usability, readability, and accessibility of technology, training and competency assessment of healthcare professionals on health literacy, community assessment of health literacy, and plain language principles should be applied uniformly to benefit public health. And I pulled up a couple of these, to talk about looking at these and reading the labels. Do they really meet the plain language criteria? I frequently will critique commercials that are on TV, especially if they are promoting a specific medication, and I'm a critic. They don't always adhere to these principles. So coming up next, we're going to be talking about team, and we're also going to be talking about conflict. And so I look forward to that with you with our next module.